Clitorydynia can affect people of all ages, and it will have a significant detrimental effect on their personal health, their sexual well-being, and also their mental health and quality of life. In today's video, we're going to talk about what clitorydynia is, the causes of why people develop this type of pain, and most importantly, effective treatments to help restore normal clitoral sensation. Clitorydynia literally means pain in the clitoris, and this can occur in provoked or unprovoked situations. Some people have clitoral pain with provocation, which means things like sexual contact, sexual touch, potentially underwear, sitting, certain types of exercise. Other people will feel unprovoked clitoral pain, which just means spontaneously during the day, they may feel a burning sensation in their clitoris or an itching sensation, or just an awareness even of this structure where we generally shouldn't be aware of it during the day unless we actually want to be. Before we can start talking about clitorydynia, we have to understand our normal clitoral anatomy. The clitoris is a sexual organ that engorges with sexual arousal. When that happens, the structure called the clitoral hood retracts, making the clitoris itself as a sensory organ available for sexual pleasure. During day-to-day non-aroused states, we have a structure called the clitoral hood, which basically covers the clitoris to protect it from normal everyday wear and tear. It protects us from friction and movement and just things where we shouldn't actually be aware of the clitoris. Because the hood covers the clitoris, and many people may not know that we can retract it and use proper hygiene by washing with water around the clitoris, it can trap things such as discharge. If there's been an infection, things like sweat or smegma can accumulate under the clitoral hood and make the clitoral hood stick to the clitoris, which can start to cause a hyperirritation of the clitoris itself and lead into some inflammatory changes, which are one of the leading causes of clitorydynia. So when I describe the symptoms of clitorydynia and some of the infectious causes or inflammatory causes underneath the clitoral hood, the technical term for that is balanitis. This is something that also happens in men who have not been circumcised, and it's just an accumulation of all the things I mentioned underneath of the hood. A second cause of clitorydynia can be hormonal deficiencies, which can lead into a reduction in the size of the clitoris, which can lead into more friction underneath the clitoral hood and some hypersensitivity in the area because there is more friction, and again, leading into some of the inflammatory causes that we mentioned previously that can also happen as a result of the additional movement underneath the clitoral hood. Another cause of clitorydynia can be as a result of surgical or obstetrical trauma. There are a number of nerves that affect clitoral sensation in this area that can be affected by surgeries or obstetric trauma. That can include tummy tucks or C-section scars. It can include things such as labioplasties or pelvic organ prolapse repairs, which may have surgical scars either above or in the vaginal area. Some women may experience clitoral pain because of vulvar dermatologic diseases such as vulvar lichen sclerosis or vulvar lichen planus. These two diseases can cause architecture changes in any structure in the vulva, including the clitoris and the clitoral hood. It can manifest as itching, pain, and adhesions. Adhesions can also exist without vulvar dermatologic disease, and those are called clitoral phimosis. This is when various parts of the clitoral hood start to attach itself to the clitoris and again can cause hypersensitivity and pain in provoked and unprovoked settings. As far as neurologic causes of clitorydynia, three specific nerves can contribute to these symptoms. Those are the ilioinguinal, genitofemoral, and pudendal nerves. The ilioinguinal and genitofemoral nerves are often involved because of things such as hernias or surgeries in the abdomen. The pudendal nerve can get involved for a host of reasons that can include biomechanical, infectious, and mostly compression and tension injuries somewhere along the course of the nerve. In a physical therapy examination, the physical therapist will examine the different nerve branches to see if they can move, slide, and glide normally. Typically, when they can't do those things, clitorodynia may present itself. In the case of pudendal neuralgia, often patients have more symptoms than just clitorodynia. They may also have burning, shooting, stabbing pain in the vaginal area, the perineal area, the anus, as well as urinary and bowel dysfunction. In cases of ilioinguinal and genitofemoral neuralgia, people may literally just experience pain in the clitoris, which can help with the differential diagnosis, understanding where these nerves go and where there are potential areas of vulnerability. And lastly, many people with clitoral pain also have pelvic floor dysfunction. Pelvic floor dysfunction is a scenario where the muscles of the pelvic floor can become tight and painful in associated causes with clitoral pain and refer pain up into the clitoris, making things feel hypersensitive, and instead of feeling touch or sexual pleasure, people feel pain. Clitorodynia is very similar to other pelvic pain diagnoses in that the most effective treatment deals with a combination of medical management as well as pelvic floor physical therapy, addressing the impairments that are present that make the clitoris hurt to begin with. So if there are infectious or disease causes that we mentioned, such as balanitis or lichen sclerosis, these are two things that need to be managed by a vulvar health expert. It's important to recognize that most gynecologists may simply swab the vagina for a bacterial infection or a yeast infection. Vaginal infections are different than infections underneath the clitoral hood. And many physicians, unfortunately, do not recognize that there can either be infectious or inflammatory or both underneath the clitoral hood itself. If you are suspicious that you have these underlying causes and your regular medical provider is not assisting you, we do recommend seeing a vulvar health specialist because this is a separate area of medicine altogether. If the clitorodynia is caused by a surgical insult, we typically will discover that during the course of the history and the evaluation. This is often managed by medical team as well as pelvic floor physical therapy. If there is minor irritation to some areas because of scar tissue that can be managed conservatively with manual therapy, that is the approach that will be taken. In some cases, surgical revision may be necessary, as well as other medical management such as nerve blocks and other interventions directed at trying to restore normal mobility to the tissue to reduce the clitoral symptoms. So if there is nerve involvement, there can be a combination of medical management and physical therapy treatments that can be effective. Medical management is going to involve things such as pharmacologic care and potentially nerve blocks. These things are going to help reduce the inflammation along the course of the nerve, either by injecting a local steroid and anesthetic or using the pharmacologic approach, which is something that people will have to take a medication for every day. From a physical therapy approach, we need to figure out where along the course of the nerve the dysfunction lies, and this can be in multiple places. And we do this by undergoing a manual exam for our patients and a movement-based neuromuscular assessment. With those two things, combined with medical care, we are able to effectively treat the neuralgias. Clitorodynia is a distressing symptom that is not uncommon in affecting a lot of people. We had to make this video today because a lot of people are going to their regular gynecologist, urologist, maybe even a neurologist, and are not coming up with answers. Hopefully this video has shown that there are many different causes of clitorodynia. The majority of them are treatable with medical management and pelvic floor physical therapy, but it needs to be handled by experts who are familiar with this diagnosis. And with the proper care, intervention, and differential diagnosis, these symptoms can be completely resolved. If you believe that you are suffering from clitorodynia from the reasons that I mentioned today, please come see us in one of our clinics, and we are also available for digital health consultations.